Hello, this is Dr. Helen Weatherly. Welcome to our GenderGP podcast, where we will be discussing some of the issues affecting the trans and non-binary community in the world today, together with my co-host, Marianne Oakes, a trans woman herself, and our head of therapies.
My name is Jordan Jakomin, and my pronouns are he, him, his. And I'm a speech-language pathologist from Chicago, Illinois. And I specialize in working with the transgender and non-binary community on voice and communication. And I recently opened up my private practice, Jordan Ross Communication, primarily serving clients across the gender spectrum, working on voice and communication skills.
Okay, brilliant. So that's a lovely introduction. So why this field? Why this group of people?
Yeah, so I think it goes back. I mean, I knew I wanted to be a speech and language pathologist when I was 15 or 16 years old, but I didn't even know that this was in the field at the time. And I remember being 19 years old, and I went to a conference. There was a huge convention in Chicago where I was going to school at the time, and it was for speech and language pathologists. And you have all these different speech therapists from all over the country that come in and present. And I remember I passed a poster board that said transgender voice and communication. And I was like, wait, what is this? This falls under our scope of practice. I never heard of it. I was never taught it in school. So I remember being inspired by it. And I went back to my school and I said, I'm really interested in this. I'm curious to learn about it. When are we taking the class on it? And they told me there is no class on it. And I was like,
of course.
Although this is changing, which is good, they're starting to incorporate it more into the curriculum. But so I did some Googling and I found the one textbook at the time that was on it. And I read it from front to back. It was interesting because I didn't understand necessarily what I was reading because I was still 19, 20 at the time. And I hadn't even been through my second year of undergraduate courses yet. But I remember I called the author on the back of the book. His name's Richard Adler. And I remember calling him, and I was 19 or 20 at the time. I'm 28 now. And I remember calling him and being like, how do I do what you do? I want to do this. I'm destined to do this. And ever since then, he's been a mentor, and a lot of people have helped guide me along the way. And I think this in particular, I mean, I'm gay, I'm cis, I identify with the LGBT community, so that is definitely a part of it. And my parents as well. I remember my dad is from Slovenia, and he grew up in, when it was a communist country, very anti-LGBT. And we grew up in Chicago. My parents are divorced, and my dad was in Chicago and my mom was in the suburbs. And they both did things that really were impactful for me. My dad, I remember he would say in his accent, he'd be like, being trans is beautiful. Like he would point to somebody, and because I grew up near Boys Town is what it's called. So there was a lot of pride events and gay, lesbian, trans people, non-binary people in the community. And my dad, I remember making a point to tell me that is somebody who's trans and that's beautiful. And I was a kid when I heard that, and it stuck with me. So maybe that's a reason. And my mom as well, when I wanted to do a little project on gender affirming voice and communication when I was an undergrad, my mom posted the pamphlet that I created on the fridge. And those were just little things that were validating for me. And I knew, I think I was 20 when I was I'm destined to do this. So I think a lot of it had to be, that's it. I just felt like I was destined to do it.
That's such a heartwarming story, Marianne. When Jordan was just started to speak, then and said, "Oh, my dad this and my mum that," I was like, what are we going to hear here? What an amazing turnaround to hear those words. Being trans is beautiful, and to have your early work with transgender people not pushed under the carpet but put on the fridge. I mean, that. Imagine if that had happened throughout your life, throughout the last 20 years. I mean, how amazing would that be? I've met lots and lots of transgender people, and transgender people and trans and non-binary people have dysphoria in different ways. So for some it might be a particular part of their body, or the way that they present, the way they look in the mirror. For some it's the way they sound to themselves when they hear what they sound like. So why is the voice so important? Why can't we just say it doesn't matter? It doesn't matter what you sound like. Just this is you. Yeah. Why is voice and communication speech so important?
Yeah, so I definitely want to start off by saying that just because somebody is trans or non-binary does not mean they need to have voice therapy, or it should be a requirement, or I believe that everybody needs to have voice therapy. I don't believe that at all. I think that that for some, voice and communication is something that they want to work on, and I want to be a resource for those people who want the service. And I think that everyone's story is different. So someone might love their voice and not want to change it at all. But somebody might want to say, okay, I want it to sound brighter, lighter. I'm really trying hard to stay away from the words like sounding feminine or masculine, because what really even is feminine or masculine? It's all changing. And yes, there's research that shows that, okay, something is more feminine or more masculine, but I'm really trying to use words like brighter and lighter, darker and deeper. And so I think for those who want to modify their voice, that there's somebody out there to help you with it. And I wanted to be that person for those people.
Can I just come in there, Helen?
Okay.
Why did I ask? I don't normally ask. I just barge in. What I was going to say there was that people come to me and they'll say to me, I can't transition until I've got the voice right. You know, it's an important part of their journey towards their gender. And I always feel a little bit sad when I hear that, because, you just think, well, you haven't. That's just what you've imprinted on your own mind. But then when I look at my own journey, I've had 12 sessions of voice therapy, believe it or not. But one of the difficulties I faced was that I didn't want to lose my identity. I didn't want to change my voice and lose my identity, not just for me, but for my family, if that makes sense. That, it's hard enough seeing us change in so many ways, and then, to take the voice. And conversations I had with different people, and I think maybe Helen's reinforced this with me at times, is, after speaking to me for a short length of time, actually it just becomes you. It just becomes part of everything. But I always say it's that first 15 minutes of talking to somebody where that's the most difficult, where they get confused, and if I could just erase that first 15 minutes. And I just wonder whether, part of what you do could be just to help people to soften the voice enough that they don't lose it, but we can get over that first 15 minutes.
Definitely. And I mean, for me, I don't want to change the essence of the person. I tell everybody, your voice is beautiful to begin with. I don't want to change you completely. Let's take what you have. And also, I'll show you all the different techniques and strategies, and you get to tell me, I like this, I don't like this. I'm not saying, okay, do this and this and this to sound feminine, do this and this and this to sound masculine. I'm going to show you a lot of different tools and techniques, and then you can decide what you like and want to do with your voice, whether it's changing it in the littlest bit or sounding, a lot different than when we started.
What you're both saying there, for someone sitting on the outside listening in, is really interesting. So Marianne, I think what you're saying is that first 15 minutes, if there's only audio clues and no visual clues to go with it, then that can be very misgendering, because you have a darker, deeper voice than someone who didn't go through a testosterone puberty. So, I mean, in many ways, if we added the visual in as well, it doesn't matter, because the visual gives you all the clues that dark, deeper voice belongs to a woman, kind of thing. And then what I'm hearing from Jordan is, wouldn't it be amazing if Marianne could have those techniques that she could use in those first 15, even just the first 15 minutes, if there weren't the visual clues, just to help her identify the space as the woman that I am, and then I can get on and use my ordinary voice because that's who I am. Is that what they're kind of saying?
Exactly. And I think it's really interesting because I don't think there should be requirements like, oh, you need to, if you're not living full time in this gender, then we shouldn't work on voice. I don't think that there should be those requirements at all, because some people would like to go back and forth between two voices, which I think is awesome. I think it's so individualized to the client, and I think that's the most important thing here. It's that what matters is the client, and not a cis-centric focus on what voice is supposed to sound like. And definitely I need to be careful as a clinician to deconstruct my own stereotypes of what I think is, once again, I'm going to use those words that I didn't want to use, but what feminine or masculine is, because it's changing. I mean, and the more I learn, get to know trans and non-binary people, and take continuing education that is trans-led, and that's not just speech pathology courses, but that are kind of about deconstructing gender. And I still have a long way to go, but the more I'm learning about, just how to be a more culturally competent clinician, because I don't want somebody to get my intake form and then already be triggered before starting, or already have that. And so I still have learning to do, but I feel like I really am on my way and on the right path.
I was just going to say, I think when you said about the visual clues, Helen, I think that does help. The biggest issues I have is even now ringing the doctors up, not knowing which of the receptionist is going to answer. And then when they ask my name and date of birth, that not all the time, but sometimes it's just that hesitation. And I can see that, did I hear that right? So I think but what that does to me, then it triggers my anxiety a little bit. And when I get anxious, I go lower.
Yeah. So,
if that makes sense, it would be good. Techniques for me would be to maintain at least a softer pitch when I'm anxious, for want of a better description. Just simple things like that, I think, will be really useful.
Yeah, and I think once again, it might be, instead of sessions for a longer period of time, it might be that we work only on a phone call and maintaining a different voice or new voice or whatever. I use different words for this new voice that I have. Sometimes I'll let the clients that I work with call it what they want to call it, whether we call it the new voice, old voice. I let them kind of give a name to it, or whatever they want to call it. But even if it's 2 minutes, if that's a success for you, then that's amazing. That's what we're going to work on. Then we're going to work on 2 minutes. We don't need to work on ordering coffee and sustaining a voice for 30 minutes. We'd work on all these skills under a 2 minute period of time. And if that's what's going to make you more confident, but not only just the confidence thing, but feel more secure and safe, and bring less anxiety into your life, then the goal is reached. At least that particular goal for the phone.
Sounds like that would be a really good springboard as well, because I think most people, 2 minutes doesn't sound a long time, does it? We're going to talk for 45 minutes today, but how often do we talk for 2 minutes non-stop? It's not actually that often. And I think, if you could get 2 minutes, that could soon become multiples of 2 minutes that eventually would become conversation as well.
Definitely. It's creating a new behavior pattern. So, typically we'll start at just word level, and then phrases, and then sentences, and then reading, and then structured conversation. And then if someone's confident enough to bring the voice outside of the sessions and go to coffee shops, and if they want to go to a bar, if they want it wherever they want to go, but to bring it outside of the therapy room. So the voice is generalizing outside, if that's what the client wants.
You've used coffee shop multiple times there, and I think that's really important, because a lot of trans women in the early stages will just go out. They'll talk to very few people, but they may want to go and get a coffee, and just being able to order that coffee could be the difference between having a really good, empowering experience of the whole day and it being just a really big ball of anxiety that spoils it.
This is so fascinating. So I started off by saying that I've met lots of different types of dysphoria, whether it's feet or nose or voice or height. And now we're actually saying, okay, so there's actually different types of voice dysphoria as well. Is it telephone voice dysphoria or coffee shop ordering voice dysphoria? Is it conversation dysphoria, or is it singing or in a loud bar dysphoria? And it's fascinating, isn't it? And Jordan, you're obviously a clinician who does, I think, what Marianne has been advising clinicians to do since I ever first met her, which is, I am this kind of clinician. How can I help you? So not come into my room and I will make your voice more feminine. Come into my room and let's talk about how I can help you. What it specifically I can do today to help you live your life more easily. And, that's what we talk about a lot, isn't it, Marianne? Really boiling it down. And this is so enlightening.
What I think is really impressing me, if I can say that, Jordan, at the risk of making you blush, is you're saying what
I'm blushing.
You're saying what we say all the time, is that there is no one trans person with single needs, that we are all individual, and the things that play out in our mind or trigger our dysphoria are unique to us. And when we see any clinician, it's really important that they take the time to understand what it is that's causing you distress and work with that. Not say, oh, well, you need this. It's what would you like? That's, and it just doesn't happen enough for me. But yeah, sit and listen. That would be the advice to all clinicians.
Yeah. I've also, Marianne, I realise now why, when if ever we're on a video call, your good old Marianne, if ever I phone you, I receive for the first 30 seconds, I receive a different type of voice, and I've just worked out why it is. After all these years, I realise. I love as well, Jordan. I love your nomenclature. A different voice, a new voice, softer, lighter, brighter, darker, deeper. So important, isn't it, to move away from these gender stereotypes, and also, when we talk about gender stereotypes, a lot of the functions that I've been to recently, the non-binary community is really rising up now and saying, "Hello, me too, me too." So I'd love to hear, your thoughts and words on the non-binary community and what kind of things they might ask for your help with.
Yeah, I think one thing is that the non-binary community is awesome. The more I learn about it and know people that are non-binary, the more I find it amazing, fascinating, brave. I think it's awesome because it's deconstructing gender in a way, that the gender that I thought, okay, and it makes me question things like, what makes me a man? What qualities? Is it because I have facial hair? Is that what makes me a man? I don't know. It's making me question a lot, but I think of my own gender, and I think it's amazing that people who identify as non-binary. And so one thing is, if somebody comes to me and they're non-binary, I'm not going to say, okay, you need to be at a certain hertz or pitch because this area is considered androgynous. But here's where the research does help a little bit. So according to the data, around 140 to 180 hertz is in this androgynous area perceived pitch. Now, these numbers are guidelines. They're not set in stone. So I would never say somebody has to be put in this spot. But if so for example, like the masculine range is 110 to 130 hertz, which is how fast the vocal folds are vibrating. It's what is perceived as pitch. And androgynous is 140 to 180. So I might start by saying, okay, maybe this is a good area for us to start. Let's see if you like it. And then I would introduce both areas. I would show them different techniques for getting lighter and brighter. and different techniques for getting deeper and darker. And then we would meet somewhere in the middle, and they get to decide like what they like, and try to make it very individualized to their needs.
That's awesome. Marianne, you're bursting. I can see you bursting to say something.
Well, I think this is I want to say a missed area, that for trans men and for non-binary, non-binary people, a lot of trans men will go on to testosterone, and the first, when we say, what you're most looking forward to by starting treatment, I would say overwhelmingly they all put voice. And actually, I sometimes think, they could probably have voice therapy to masculinize the voice. And I think that's where there's a crossover. So I wonder sometimes if some people would be happy in a non-binary identity, but because they feel they won't get access to treatment to lower the voice, and they want a lower voice, but they won't get access to treatment if they admit that they are non-binary. And I always think it's quite sad that if they feel they've got to prove themselves to get the testosterone purely to lower the voice, when actually maybe voice therapy would be a lot cheaper in the long run, and would just be enough for them.
Yeah, and working with non-binary and trans-masculine clients has been kind of overlooked. Now there's more research coming in on it, which is amazing. Testosterone is shown to, thicken the vocal folds and decrease pitch by about an octave. But my friend and colleague, Aaron Ziegler, just recently did a study with a few other clinicians in which they kind of analyzed all these different research studies on the effectiveness of testosterone. And I'm pretty sure it was around 20% of the people in the study, out of these, I believe it was 19 studies, they didn't reach like cis normative data for cis men. So it's showing that testosterone isn't necessarily working for everyone who's using it. And some people don't want to be on testosterone. They don't want it. So you could teach them different techniques on how to lower pitch safely. And also something like to work on is resonance with them. So changing like the shape of the mouth and the lips and the throat in order for the sound to come out as darker versus brighter.
Well, I like that description, darker versus lighter.
Marianne, you're a fan, aren't you? Okay. The other thing I'm hearing a lot, which is one of my hobby horses, is education here. And Jordan, I don't want to keep bigging you up, but the fact that you're talking about getting your education, both from the research, so from the science and from the published research, on those pitches, on the numbers, you'll also keep talking about the trans-led education. So, and that's so, we talk about this so much, where are you? You're a cisgender person. How are you going to learn what the trans population or trans and non-binary community need? Where are we going to learn it? From the trans community themselves. So important at that education. And I'm really pleased that you do that.
Absolutely. And even thank you for mentioning that. And even on my case history forms, I thought they were very culturally competent before they were looked over by anyone. And then I actually had two trans masculine speech pathologists look over my case history forms, and they helped me a lot. And I didn't realize some of the questions I was asking. Okay, here's one example, like preferred pronouns. Pronouns are not preferred pronouns. And that was one thing I noticed. Another thing was talking about, I asked, how long do you plan to complete, or what's your timeline for a complete transition? Well, what the hell even is complete transition? And why am I even asking this? So there were some questions on there that I didn't think were triggering or offensive, but once I had consultation services that were led by trans people, it really helped to open my eyes to things that I wasn't paying attention to before.
Well, I'm going to admit now that an early version of my website talked about transgenders, when referring to people, and I can't believe that's where my education level started. I shake my head at the thought.
I think it's good to bring it up though, because I think whoever it may be, the community is listening to this, or a therapist is listening to this, and they might think, okay, well, maybe I need to get some consultation services as well. And on my website, I put the training, not just that I've done speech pathology related, but also the training that I've done for the consultation services. The name of the company for that was Q Inclusion. And they went over my case history, and they were so nice about it too, because I was embarrassed a little bit that I was like, wow, I thought, and the way they it was so respectful how they educated me, and they opened my eyes, and I want to spread awareness about that to clinicians in my field and clinicians in other areas as well.
I think the language is really important, but it's evolving at such a speed as well, because it's interesting what you said there, Helen. I think the more visible with trans people and gender diversity is integrating into the wider society, then the language is going to evolve. And, we did used to say preferred pronouns because we were asking people to respect it. I would prefer it if, it was almost an apology. I would prefer it if you use these pronouns, and it became part of the language. But we've evolved beyond that, but at a rapid rate. I think the last 5 years, it's just accelerating. So yeah, really important. Anybody working in the field is at least trying to keep up with that. We were talking about, having, even a dual voice. We could have a phone voice but one of the reasons I struggled as well, as anybody that knows me will recognise, part of my identity is I sing and play guitar. And changing my voice would have just not worked, because how I sing is an equal part of my identity. That I've worked with some non-binary people that won't go on T because they are a singer and they don't want to lose their voice. And I suppose the challenge or the question I would put to you is, can people maintain their singing voice and change their talking voice, if that makes sense?
Absolutely. But that's when I would probably refer out to a singing voice specialist that specializes in the singing voice as well. So I love to sing, but I'm not a trained professional singer. But there are clinicians out there that I do believe are singing voice specialists as well as voice therapists, and so I think it's definitely possible. With T, I think the dosing has to be maybe and could be a little bit different or monitored. I'm not sure exactly what the dosing of it would need to be or exactly, but it needs to be taken into consideration. And then to definitely consult with it gets hard because there's not a lot of us already voice therapists who specialize in gender affirming voice. There's even less that specialize in the singing voice. Now, this is where maybe you could go outside just looking for a speech and language pathologist, because there are like voice coaches or singing specialists that are doing this work as well. There's one lady outside of Chicago named Liz Jackson, and she's a singing specialist. She has a book that I've read, and it's a lot of techniques that you take from singing, and she's great. And my friend and colleague Heather is a singing specialist as well, and so there's people out there. They just might be harder to find.
Mm. It brings me back to one of my favorite topics, which is the education. And there's too few people working in the field, or never mind the subspecialties of the fields. But actually, I was interested in 10 minutes ago, we were talking about education, and actually it's education of the client, the patient, the service user as well, isn't it, Marianne? I'm really interested in what you say, the fact that some non-binary or transmasculine people, if they only feel that the way that they can properly or enough for them lower their pitch of their voices from testosterone, then that's the way they'll go. Or even just to validate their gender, when that might not be what is right for them. And actually some work on the voice, some education on their voice. I don't want to call it voice therapy because it pathologizes it, but some voice education might be just enough. So this is news to me today. So if it's news to me, and I'm a doctor and I've worked with it in the community for a long time, it's going to be news to a lot of people, a lot of transmasculine or non-binary people. Really important, that education, isn't it?
A huge part of a huge piece. So usually the first session is spent on education of kind of like the anatomy and physiology, learning about the different components of speech production. So respiration, the importance of breathing, how our vocal folds vibrate and come together, how sound is modified and shaped. So the resonance of the sound, it's why we all sound unique. And how the sounds are articulated, all important components to understand if you're wanting to modify your voice. And then a huge education on vocal health. So how much water should you be drinking, becoming aware of allergies or managing allergies, not drinking too much caffeine or alcohol because it's drying for the vocal folds, also known as the vocal cords, they have two names. And so definitely a lot of education, and usually in my first sessions, I usually say, okay, it's a little bit lecture-y this time. I promise we'll get into more exercises as we go on, but it's really important for you to kind of understand the basics before we go on into jumping right into exercises.
I was going to say, we're talking about education as well, and one of the things that's kind of blowing me away today is how far have we come in this area. I'm just imagining probably 10 years ago, it was just purely about pitch and intonation, and somebody take you on, and if you practiced hard enough, you'd get something that resembled a feminine voice. But actually, the way you're approaching this is far more person-centered, basically.
Thanks. And it wouldn't have been for the speech pathologists who have come before me. I mean, Richard Adler, Sandy Hirsch, the ones who wrote the book, Aaron Ziegler, my mentor, and Christy Block, Leah Halou, these are all researchers in the field that I remember and Adrian Hancock, these are people that are celebrities to me. I mean, I admire them so much, and they've written books and made material like accessible for students like myself at the time, when there was only one book at the time when I was in grad school. Now there's 3 or 4 that are out, and it's amazing. And I think I am the way I am because of them. I'm so grateful for them, and they've all known me since I was 19 or 20 because I would follow them at the conferences. I would be the person that went up to them after and say, I really want to do this. How can I do this? And I've kept in touch with all of them throughout the years. It might not be, some might be on a monthly basis. Others might be once a year, but I'll send them a message because I want them to know I'm literally living out my dream and my life purpose because of all of you. If it wasn't for all of you, I wouldn't be doing this work. So I want to give credit where it's due.
I'm going to also, Jordan, I'm going to give a little bit of credit to mum and dad as well, because you described the non-binary community a short while ago as amazing, fascinating and brave. And it just reminded me of your dad, telling you that trans is beautiful. So, that role model that you had both professionally and at home has really, set you up to live your dream, which is really, really lovely. one of the things you mentioned, that a couple of things actually, always. You talked about vocal health, and you mentioned lowering pitch safely. So that implies that there might be unhealthy ways or non-safe ways. So I'm interested in that.
Yeah, so lowering or increasing pitch safely. So if your vocal, we use muscles, to make our voices go higher or go lower, and so we need to work out those muscles like we do our biceps in the gym, and so it's going bit by bit, and really it's important to kind of start in a safe zone. So remember, these numbers are set in guidelines, so they're not exactly where everybody should start, but if somebody is wanting to maybe go up in pitch and increase their pitch depending on where they are at the beginning, 164 hertz is usually a good place to start, which is equivalent to E3 on a piano. So pianos are helpful because it's more perceptually salient. If I said, okay, I want you to speak at 164 hertz, people would look at me and say, what the hell are you talking about? But if I hit a note on a keyboard and say, this note right here, this is a good place to start. Same thing for if you're wanting to go down in pitch, E3, that 164 hertz falls in the middle. So we would either work on working our way up a little bit or working our way down bit by bit. But pitch is only just one component of voice and communication therapy. There's so many other components, and I think there's this myth out there that if I just work on increasing or decreasing my pitch, that that's it. But there's some couple of other key components, one of them being something called resonance.
So the safety and the health bit means really going gently and slowly. So not going from that pitch to that pitch straight away all the time, but really just going slowly.
Also making sure you're relaxed, because sometimes we'll, use the muscles in the neck, incorrect breathing patterns, which are straining for the voice and can cause actual voice disorders already, because sometimes I'm sure there are awesome YouTube videos out there that have been, helpful for a lot of people in the community, but there are some videos that you have to be careful with that are, hold your larynx up tight and squeeze it really hard. Like, that's going to give you muscle tension, and that's not sustainable. It's not healthy for your voice. But it's, I also, if somebody wants to do that, I will educate them, but I will not say, how could you do that? Don't do that. Maybe that's what they want to do as well. So once again, I try to come from a place of education, but understanding as well why somebody might have done that to sound more, in this case, squeezing your larynx up and holding it very tight might shortens the vocal tract, but that's not the way I work on shortening the vocal tract. I do a couple different exercises. So every clinician is going to have different, techniques and strategies, but just to be careful with the YouTube videos, because sometimes the videos out there, they're not licensed clinicians, they're just kind of giving you advice that may be very helpful, but it also could be harming for your vocal folds. So just be careful.
It just reminds me, from the medical point of view, of people who are self-medicating. And yes, people self-medicate, and there are people who give advice on the internet, which, might seem like very good advice. It comes from a base of really wanting to help people and wanting people to achieve and attain what their goals and what they want. But, you can't get away from the education and that clinicians do go through, Jordan, whether it's a clinician like you or a clinician like me or a counsellor like Marianne, in learning from everywhere. So learning the research, learning the science behind it, and then having the trans-led education to top it all off. So really important. And it just reminds me of people who are self-medicating. And why do people do that? People do that because there isn't the option freely available for them to do whatever, to achieve their goals safely. And so they have to achieve their goals in some way. So therefore they will do it self-medicating, self-learning, and via YouTube from very helpful people who want to help. But I agree with you. It makes me want to keep these people safe, really.
I come across a lot of people that have been trying to train the voice, whether it's up or down, and they will complain of a sore throat and that it gets tiring as the day goes on, trying to maintain. So they found what they want to do, but actually because they're not doing the right exercises, then that becomes wearing, and they're getting sore throats and, muscle strain in the neck. And so good advice and good exercise, and then understanding what it is that you're actually doing is really important. The other thing I kind of was just going to raise as well, because when we, I think this is across the board for transgender healthcare. I don't know whether you both agree with me, but one of the things we have to, I want to say, battle against as clinicians is people come in and they've seen a snapshot of what somebody's achieved on the internet without any backstory, and they think that's what I want. And then we're having to kind of say, well, let's step back a bit, because you don't know what that person's gone through. And somebody made a really good point to me once. They said, do you want to sound like a woman, or do you want to mimic a woman? Because there's a big difference. And I think a lot of what's on the internet is trying to mimic somebody else, or mimic what it is to be a woman or what it is to be a man, whether it's with the voice or whether it's with other things. It's really important that actually what we're doing is genuine and is unique to us. Like I say, I don't want to lose my voice. It would just be nicer if it didn't give me away so much, if that makes sense.
Totally makes sense.
Marianne, don't get me started. Didn't give you away. It's just like, oh my goodness, Marianne and I have this. We'd put you out of business, Jordan, because I keep saying to Marianne, look, that's you. That is you. That you are Marianne. You are a woman. Never mind what a woman's voice is supposed to sound like, And those words, actually, Marianne, that you say, are you mimicking a woman or sounding like a woman? What does a woman sound like? A woman sounds like you and me, Marianne, because we're both women. So
I was just going to say, though, as well, I think another really important thing is, as well, I'm really fortunate. I seem to be surrounded by people that are really affirmative and have never made me feel awkward. I mean, okay, I feel awkward on the phone, and maybe there is some awkwardness, but not with people in my day-to-day life. I work with a fantastic team at GenderGP. My family are really good. Nobody ever raises an issue with my voice. There's never a flicker of confusion. I think for people that are dealing with it in a different way, that are getting it, maybe that, it would be a different experience. But, I went to voice therapy to learn that there was nothing wrong with my voice, I think, is what I took from it.
But Marianne, isn't that's so actually what we need to change is society. You live in a comfortable world where people affirm you. You're in your workplace, in your home, and in your community that surrounds you. You are affirmed, and therefore you are able to accept your voice as being you, part of you. And if only everybody had that, and that's what surely we as society need to work on, isn't it? Is everybody having that warm, gentle place to live in and exist in.
I completely agree. I think about that all the time. Like, what if my job, my job doesn't exist in the future, because people are just more accepting and loving, and we all are human in the end,
But that's the aim, actually, Jordan, is to put people like you and me out of business. We shouldn't be needed anymore. But we've got a little way to go there, I think. I mean, it's interesting. You both talked freely about the fact that you can both sing, and you have that quality that you are able to do. I have to say, I cannot sing, and I don't think that there is any education or any transled or research or anything that would ever help me be able to sing. So we're all different in that way.
I suppose one of the questions I had, Jordan, I don't know if this is a fair question or not, but for any listeners coming in, what I always say at GenderGP is, tell us what your expectations are. And I'm not going to say we can meet them, but what we will do is give you best advice. and we will do what we can to help you meet your expectations within the bounds of good practice. That means that what I'm inferring there is there may be limitations to what anybody can do to help you. You know, if you want to look like the Kardashians, I don't know why I thought of them, but if you want to look like that, it's just, you know, your expectations are beyond. What are the limitations with voice therapy, do you think? Or well, yeah, what are the limitations?
One limitation could be the inability to practice. So maybe they aren't comfortable using their voice outside of the session, and so they want to have a completely different voice, but then they're not using it. It's a lot of psychology involved in this, which is why I think our fields need to be collaborating a lot more, or I need to go back to school and get my master's or doctorate in counseling or clinical psychology, because there's a lot of counseling and psychology involved. It really is unique for, everyone. Some clients I work with progress very fast and just get it and are able to, create a new behavior with their voices, while others, it's difficult and it's more challenging. It really depends on the client. Now, like in terms of like the shape and the size of a person. So if somebody has bigger spaces in their neck and mouth, the sound is going to come out deeper or darker. I like to think about it like there's a speech pathologist. I mentioned her before, but her name's Christy Block, and she's in New York. And remember being on her website and reading about this comparison has always stuck with me, but it's comparing a violin and a cello. So a violin is smaller, so the sound that comes out is going to be brighter. And a cello is bigger, so the sound that comes out of the cello is going to be darker. So we can manipulate the spaces in our mouth and in our throat to sound more like a violin or more like a cello. And so it's really interesting, some of those different resonance exercises and how we could literally change the energy of the sound. And that's where it doesn't just go into pitch, but literally changing the color of the sound, which is it can be a little complicated, but when somebody gets it, it's pretty cool.
What a great way to visualize actually what's happening with the voice, the violin and the cello.
Yeah, it's really helpful. And it's like it was analogy that stuck to me when I was learning about this field. So it's really fun for me to use it when educating my clients about it.
Just dawned on me then as well. Maybe that's I said to you what the limitation you said about practice, and interestingly enough, when you hear a 10-year-old trying to learn the violin, sounds awful, and the family are going, oh, for God's sakes, shut the door, go in the garage, and actually we have to go through that part of our process if we're going to change our voice, where it may be great on people that it's jumping in and out and going all over the place, and we will be told to stop. But actually, if we want to become a violinist, we've got to keep practicing, haven't we? And it must be the same.
Exactly. And speaking of practice, at-home practice, that's the most important key, actually. I can give you all the skills and different, strategies and worksheets, but if you're not practicing at home, then there's not going to be an improvement, because it's a behavior. You have to do something over and over and over again in order for that, for there to be change.
Would it be fair to say that really there's a good entry point if you're going to change your voice? If you was trying to change your voice before you actually start transitioning, or certainly socially transitioning, that you're going to have limitations because you're not going to be able to use it. You can do all the practice, but if you're not going to be able to go out there and try it, that it's going to be really difficult motivation. So actually,
there definitely could be limitations, but I would still never say no to somebody just because they were at the very beginning of their transition. But it might be more difficult in terms of practicing outside of just the one-on-one time we have together.
Thank you so much for listening. I really hope you enjoyed our program today. Please go ahead and subscribe to future episodes if you haven't done so already. If you or anyone else have been affected by any of the things that we've talked about in our podcast today and you'd like to contact us, please visit our website Help Centre and contact us via there. We're very happy to accept ideas for future episodes and future guests, so let us know if there's anything specific you'd like us to cover. You can also visit our website gendergp.com for a multitude of information about transgender health and wellbeing issues. You can follow us on social media. ID is @GenderGP, and you can sign up to our monthly newsletter. Full details can be found in our show notes on our podcast page. Thanks for listening, and see you soon.